A hallux rigiditus. It is basically when there is rigidity of the hallux, first metatarsophalangeal joint. On clinical assessment, there will be a dorsal bunion. The range of motion might be reduced, especially the dorsiflexion will be painful, and a grind test can be done. These are common in osteoarthritis, rheumatoid arthritis, and post-trauma. Classification is called Hartip and Johnson. Grade 1 is no joint space narrowing, grade 2 is mild joint space narrowing, and grade 3 is complete joint space involvement. 1 will need no surgery, supportive non-operative treatment. 2 will do chelectomy. 3rd will need arthrodepresis or arthroplasty. For non-operative management, I will advise a white toe box shoe. I can advise Morton extension foot plates, which limit the MTP fusion while push-up. For joint preservation surgery, I can advise a chelectomy, which is minimum of 20% of articular cartilage can be removed to prevent failure, or a Moberg procedure, which is basically a dorsal closing wedge osteotomy of the proximal phalanx. The joint sacrificing procedures can be a Keller excision arthroplasty, which is indicated in rheumatoid arthritis patient, and we excise the proximal end of the phalanx. It can cause instability and can cause cock-up deformity as well. Another recent advance is a Cartiva implant. A Cartiva is a celastic implant which can be placed. The risk is osteolysis and synovitis, and which can cause pain. Other option can be capsular interposition arthroplasty. And a gold standard is fusion. Fusion is done with a 0 to 5 degree of valgus with 20 degree of dorsiflexion compared to the first metatarsal.